Please keep this information in mind while viewing this video. Make sure PPE is properly fitted, including appropriate glove size. Ensure a hospital-provided stethoscope is available for use in isolation rooms. Use of additional PPE, such as goggles and shoe covers, are not demonstrated in this video, but are available as needed. Before donning your PPE, ensure that you have all the necessary equipment. This will be based on the type of isolation your patient is on and the exposure risk of the task you're about to perform. Your PPE could include a gown, a face shield or goggles, gloves, a mask, and hand hygiene availability. For this video, we will demonstrate using a procedure mask with attached face shield. PPE should be donned before entering the room or patient care area. First, perform hand hygiene. Hand hygiene demonstrations have been altered in this video for the purpose of time constraints. When performing hand hygiene, always follow proper hand hygiene processes by washing your hands thoroughly, including the front and backs of the hands, the wrists, and in between the fingers. Don your isolation gown. Ensure that the gown fully covers the torso from neck to knees, arms to end of wrist, and wraps around the back. Fasten the gown securely at the back of the neck and at the waist. Don your ear loop mask with attached face shield. Place each loop over the ears, then grasp the nose piece of the mask and squeeze to mold the mask to the bridge of the nose. Ensure your mask is pulled down under your chin. Don your gloves. Ensure that your gloves extend to cover the wrists of your isolation gown. You may now enter the isolation room. While moving from dirty to clean tasks inside the patient care area, be sure to remove soil gloves, perform hand hygiene, and don clean gloves. When you are ready to exit the isolation room, begin the doffing process inside the room at the threshold of the door. Do not wear used PPE outside the patient care area. Begin by removing your gloves first. Do this by using your non-dominant gloved hand and grab the cuff of the other glove in the wrist area using a pinching motion. Peel this glove off by turning it inside out as you pull it towards and off the ends of the fingers. Wad this glove into a ball in your gloved hand. Then take the index finger of your ungloved hand and slide it carefully under the cuff of the gloved hand, and peel this glove off by pushing your index finger forward, turning the glove inside out. Dispose of the gloves and perform hand hygiene. Next, remove your isolation gown. The front of the isolation gown is considered contaminated, while the back and ties of the gown are considered clean. Remove the gown by reaching around and breaking the tie at the waist and neck, only touching the back or inside of the gown. Lean forward and roll the gown inside out away from your body into a bundle. If using the Terralone Bio gown, place the gown into the collection bin that should be located inside or near the room or patient care area. Perform hand hygiene before or while exiting the room. Once outside the room, remove your mask with face shield. Remove mask with face shield by grasping ear loops from behind the ears and pulling forward away from the face, careful not to touch the eyes or face. Perform hand hygiene. Summary and quick tips. Select the PPE to use based on the type of isolation your patient is on and the exposure risk of the task you're about to perform. Good hand hygiene is essential to preventing contamination before, during, and after donning and doffing procedures and while caring for your patients.